Marks week 9 of a strike by Kaiser Permanente mental health care providers, and we've been following this story since the beginning. Those on strike say it's not about the money, but about the time they have to provide quality care to their patients. But Kaiser says that the union's demands would mean fewer appointments. Becca Habegger shows us what's at the heart of all of this.
When therapists are under attack, what do we do? Stand up, fight back!
Jenny Butera is one of about 2,000 psychologists, social workers, therapists, and chemical dependency counselors in Kaiser's Northern California region, represented by the National Union of Healthcare Workers. Since August 15th, hundreds of these providers have been on strike, demanding three main things they say will lead to better patient care. A caseload cap. Currently, they say there's no limit on how many patients a provider can have at one time, and the union calls caseloads unmanageable. More returning patient appointments and fewer new patient appointments to have more availability for existing patients, and more time for indirect patient care. That's the time a provider spends outside of seeing patients.
Indirect care is actually tasks that we need to do to provide for the patient. Oftentimes that might be calling the sheriff for a welfare check, doing a 5150 on a suicidal patient, contacting CPS for reporting a child abuse case. So a lot of things that are only possible if you're a licensed therapist.
Plus replying to patient emails and creating treatment plans, the union says. But Kaiser Permanente says they've met the union halfway at the bargaining table on indirect care time, only to have their offers rejected. The union's excessive demand would reduce the number of appointments we currently have by more than 2,500 every week, Kaiser Permanente tells ABC 10. This takes us in the wrong direction at a time when the need for mental health care has never been higher. Kaiser Permanente has been clear we're not willing to do that. We have extended all that we can without jeopardizing the care we bring to patients. In terms of caseload, Kaiser says our therapists in adult and child mental health clinics who provide individual psychotherapy see an average of 5 to 7 patients per day. In addition, we have an administrative structure in place to ensure an appropriate amount of preparation time and time to support ongoing education. Butera says it's about quality over quantity.
Patients are suffering. They will continue to suffer with our current caseload and our current schedule, the way it's made up.
Also at the heart of this is a law called SB 221, which went into effect in July. It aims to strengthen Californians' timely access to mental health care by requiring healthcare service plans, including Kaiser Permanente and health insurers, to provide follow-up mental health and substance use disorder therapy appointments within 10 business days, unless the therapist decides the patient can wait longer.
Not all patients need that time or need that frequent of a session, but many do, and we just can't get them in. So we're waiting. Some therapists have some availability in 4 weeks. I certainly don't. My earliest is typically 6 to 8 weeks out.
The union claims Kaiser is violating SB 221, especially with hundreds of providers still out on strike. Kaiser Permanente responded to that, telling ABC 10 the new law aligns with Kaiser Permanente's long-standing commitment to provide timely, high-quality mental health care and substance use disorder treatment to our members. The implementation of SB 221 is challenging for all health plans and providers, not just Kaiser Permanente, given the overall demand for mental health care and substance use disorder services and the documented shortage of trained professionals both nationally and in California. Implementation of SB 221 to Kaiser Permanente's model of mental health and addiction care and services is well underway.
The 10-day rule seems to be pretty reasonable.
We reached out to Richard Frank, a senior fellow in economic studies with the Brookings Institution and director of the USC Brookings Schaefer Initiative on Health Policy. He says the aim of SB 221 is a good one, trying to make mental health care as accessible as physical health care.
What we're really interested in is making sure that people can get quality mental health and substance use disorder services when they need it, at a reasonable point.
And Becca's with us right now. Becca, I think my first question is, how many people is this directly affecting?
Yeah, this is hard to quantify because at this point, Kaiser is working with patients, it says, to help connect them with providers who, if their provider's on strike. They do have community contracted providers. But Kaiser also says 65% of the providers who initially went on strike are back in August have since returned to work. On the other hand, the union says patients are affected by, having to wait weeks to schedule a follow-up appointment with their provider. And they said this was an issue even before the strike happened. The union says that.
The union says this was an issue before the strike.
Yeah, the union says this was an issue. These long wait times were an issue before the strike. It's just that now SB 221 is that law that went into effect July 1st of this year, which makes extending follow-up appointments beyond 10 business days in violation of the law. So, that is the law of the land right now. These follow-up appointments have to come within 10 business days. The union says Kaiser is violating that. Kaiser says they are working to implement SB 221 and that they have a network of community-based providers. So they say they are not in violation of the law per se.
And Kaiser also mentioned a provider shortage. Talk about that a little bit.
Yeah, sure. Studies have shown that California has a shortage of mental health care providers, but how acutely it's felt really depends on where in the state you live. Generally, urban areas are better serviced. Rural areas have a tougher time. The union, however, says it's not about a provider shortage. It's about work conditions. They say providers don't want to work for Kaiser because of the conditions that I laid out in the story. Kaiser, on the other hand, says it really comes down to a provider shortage, and they're working with the union to try to come to an agreement. At this point, though, as you've seen, they have been on a strike for 9 weeks now, and it looks like an answer isn't quite yet, an agreement isn't quite yet in sight.
All right, Becca, thank you. And we've also been hearing from you at home on this issue, and Becca's going to be sticking around because when we come back, we'll share some of what Kaiser patients who wrote into us had to say about this issue. All right, now before the break, we went in depth into the mental health worker strike at Kaiser that's now entering its 9th week. Today is World Mental Health Day, and we wanted to know if you at home have had trouble accessing mental health care. Now, Becca, you've been covering this for a while now. I want to read some of the viewer comments that people wrote into us. We have Chris Sean. She said that you can do an intake appointment with Kaiser, and the next available appointment isn't for about 4 to 6 weeks. If you get an outside referral, you can be seen almost as soon as the next day as your authorization. Authorization can almost take about a week as well, she adds. And then another person told us that they're with Dignity Health in Sacramento using a purchased health insurance plan. They also say that they've called 8 to 10 therapists who are in network, and only one of them, Becca, one of them was accepting patients. So that person said, quote, "It's shocking how rationed mental health care is." You've been covering this. What do you make of those comments?
Yeah, and at first I think it's important to point out that we reached out on a side note to both of those people just to say, hey, was this your personal experience? Do you work for Kaiser? Is this something that you heard from a friend secondhand? Both of these individuals told us that it's a personal experience with Kaiser, and that second person said it was also their experience at Kaiser and at Dignity. Yeah, that they had long wait times. Look, my impression of this is that it really squares with what we're hearing from both sides. The union at Kaiser, who's representing the mental health care workers, they say there are long waits, 4 to 6 weeks to get either an initial appointment or a follow-up appointment. They say that's an unacceptable wait time to get mental health care. On the other hand, we are hearing from Kaiser Permanente that they have this list of community-based providers that they can give to people. People are able to reach out on their own and say, hey.
But reach out on their own.
Reach out on their own and say, hey, are you taking new patients? Or, hey, can I get a follow-up appointment if it's someone that they've seen before? So in this case, it depends on your opinion on this. Do you want to do the work to reach out to find someone? Do you think that your insurer, your HMO should be doing this for you? So again, both sides have their positions saying that they're doing what they can, but the union maintains that 4 to 6 weeks is an unacceptable amount of time to wait for a follow-up appointment, and that's what these folks, these commenters are telling us.
All right, Becca, thank you. Keep writing into us. We want to hear from you.